This is Atif Adam. I'll be speaking on behalf of the Health Equity Working Group. Similar to Devere, we had a whole bunch of objectives that the group tries to maintain. A key part of that is generating and disseminating substantial work around health equity and inequities across our studies. We've been working closely on adding in social determinant factors and building extensive tool sets that can expand out our OHDSI work itself. A key part of our work has been engaging the broader community both within OHDSI and outside OHDSI on enriching the work we do in terms of health equity related projects across all network studies. Something that we wanted to focus on this year, Craig, if you want to go to the next slide, is trying to keep things simple in terms of our OKRs for 2024. So we framed it around three broad areas: research, engagement, and integration. These are key areas that the work group members wanted us to focus on. So research is kind of adding into some of the work we're doing, where equity work is presented in network studies. Engagement, how do we better engage the community itself? And integration is primarily working with other working groups at IQ in OHDSI, as well as groups outside OHDSI itself. So based on this, for research, our milestones that we hope to achieve by the end of the year are having at least 2 health equity-oriented studies coming out of our work group, and inviting OHDSI and non-OHDSI speakers to present their work in an ongoing journal clubs. For engagement, we want to extend to have 2 webinars and workshops outside the symposiums, where we invite experts and committee members on key areas, either as cross-collaborative work similar to what Devera mentioned, or work groups projects as well. Integration, so we've been working closely with other work groups, but we wanted to kind of keep that as milestones as well. So with the GIS working group, we want to quantify the impact of social environmental determinants of health on healthcare resource allocation. And just like Devera said, working closely with the OMOP to FIRE working group, gender harmony and occupational data health amongst the groups itself. The stretch goals are something that we hope to achieve, but we don't want to keep it as something that we want to do. But mostly it's getting our work out in some sort of publishable format, but also having a mechanism where community members can respond back to us either through the forums or have other channels to grow our responses year to year. Our work group meets on the second Wednesday every month, and we have a channel on Teams as well. So looking forward to having everyone there.